gap. Although physical activity is key for aging, inactivity rises sharply after the age of 60 for people almost everywhere. By 2030, it is estimated that global levels of inactivity could rise to 35%. These new findings are a wake-up call. This WHO report has a clear message. We need to get moving to help more people be more active. This will require governments and stakeholders across sectors to partner to implement policies and programs, particularly to engage more women and older adults, to provide more support for innovation and local solutions, and to better align resources with policy commitments. Whether it's walking, cycling, dancing, or playing sports, regular physical activity is good for everyone. Let's all work together to get the world moving.
The program is still Sound Health on Lagos Television. Joining us this evening is pharmacognostist Oyindamola Awosola Fadolapo, and she is going to tell us what exactly is prescription error. Good evening, I'm pharmacognosist Fadolapo, and thanks for joining us.
Good evening, thanks for having me.
All right, it's a pleasure to have you on the show. So tell us, what exactly is prescription errors? What do you term as this topic?
Prescription error refers to any mistake or inaccuracy that occurs during the process of prescribing. It could also be in the process of transcribing and dispensing or administering medication. And, this error can happen at any stage of medication use, whether, like I said, prescribing, transcribing, dispensing, or administering the medication. And, there are various factors that contribute, to prescription error. It could be human error, in the process of transcribing what was written by the physician, mistake in handwriting and all of those.
Okay, so can you regard this as medical negligence? Oftentimes you hear people say, I don't know what happened to the medication I was asked to use. Can this be tagged as a medical negligence, or can it be just on the part of the patient too, not just the medical practitioner?
Well, there's various factors, like I said, human error. Sometimes it's due to the workload. Sometimes you are seeing more than the number of patients you should see per day, and you're stressed out. So one can make errors. And in other hands, too, lack of knowledge can lead, to prescription error. Also, communication failure. For example, one goes to your hospital and was diagnosed and was given AIDs, ibuprofen, and all of those for treatment. However, that person has ulcer. You're not supposed to prescribe such drug for somebody who has ulcer, but the person didn't communicate properly to the physician. So it's more on the physician than on the patient. However, there are other factors that lead to it. So I already mentioned inadequate patient information, lack of knowledge, human error, communication failure, workload, and fatigue.
Okay, what are these other factors? Can you let viewers know about them?
The factors that lead to prescription error?
Yes, apart from those ones that you mentioned.
Yeah, I already listed 5 major. So those are the factors. And, probably wrong labeling on drug products, mistakes in handwriting, and all of those. They are part of what leads to prescription errors.
The World Health Organization attributed electronic prescribing as one of the major factors causing or leading to medical errors or medication errors. How can we address this? Because we are also clamoring for advancement of technology, advancement in ICT in all fields, especially the health sector.
Okay, thank you. Electronic prescribing system actually, to the best of my knowledge, has helped even to reduce the prescription error rather than increase it, because there's a physician behind the bar, there's a physician behind the electronic prescription, using the systems to prescribe. So usually, what is written on the system is legible. You can read it compared to some handwriting that we have. So I feel from my end, I would say that electronic prescribing system has helped to reduce this error and even improve accuracy in prescription.
But it is one of the causes cited by the World Health Organization. Could it be as a result of input in terms of error in imputing these facts?
Yes, that's errors in imputation by the physicians from the dispensing end of the hospital or facility.
All right, so let us look at the risk now. When a patient experiences medication error or prescription error, what are the risk factors now?
Okay. A patient may experience ample side effects, and those can be reported in Nigeria to the pharmacovigilance wing of NAFDAC. That's if the patient or the physician quickly notices that, okay, this is what is causing it. Then, incorrect dosing or all of this can even make a patient stay longer in the hospital. When the prescription given to the patient is not related, or can even cause more harm than good to the patient. The patient has to stay more in the longer stay in the hospital. Then, increased morbidity and mortality. There's death. When given a wrong prescription, for example, somebody with high blood sugar is given something that can increase insulin. At the end of the day, the patient is gone even before the end of the treatment. So a lot of things. Economic impact, the government is subsidizing drugs. And at the end of the day, a lot of people are given wrong
medication.
So at that time, the government will spend more on medication. The patient, if the patient is not under any insurance, health insurance scheme, is paying more on this medication. So those are the major things which, death is fatal. So aside from therapeutic errors, adverse
drug effects,
reaction, and the economic impact, cost, and all of that.
At what point will a patient know that he or she is experiencing prescription errors? Is it after death, from your experience now?
Well, usually, I would say the deed has already been done before patients even know or notice, except the patient is quite informed about the medication that he or she is about to use. So at that point, we realize that, okay, this drug, I'm not supposed to use it, or this drug is not what I should use. Some of them notice after there is ADR already, when, they are seeing the adverse drug effects already. So, but for physicians, in the process of collation or in the process of reviewing the patient's medical history, they can detect that, oh, this shouldn't have been given to this person, this should have been given to this person. And even at the point of dispensing medication, and, if it's a patient that has been using the facility for a while and the medical history is even stated, you can realize that, oh, this drug shouldn't be given to this person, and can inform the physician that prescribed it, and, things can go well. But usually, it's almost at the end when, there's a reaction.
Or there's no improvement.
Yes.
Okay, so
And
tell...
of course, at the point of death, that's when it is noticed. So usually when, a nurse that's supposed to give the medication, let's say it's an inpatient thing, discovers that that patient has been administered wrong medication, the nurse can inform, the attending physician and take steps towards the safe food. Then at the pharmacy too, we can also, realize they would ask questions. There are certain medications that even after the attending physician has prescribed, they ask questions at the pharmacy, so as not to, be guilty of this. Yes.
Okay, so is there any difference between prescription error and adverse drug effects?
Yes, prescription error is different from adverse drug effect. The effect of using a
Is
drug,
there a thin line between them?
there's a wide gap between them. It's not just things. They are critical concepts. So one is due to mistakes that occur when prescribing. The other, actually, they are harmful, they are unintended, whether it is by human error or probably by the drug, even the right drug itself. It can even occur when somebody uses a normal dose, the correct dose, that's advanced drug effect. But for prescription error, it's an error, made already by, in the process of prescribing, transcribing, and dispensing, or dispensing with what the attending physician has written already, and, giving correct drug or wrong dosing, or probably supposed to be IV, it's given in another route, or maybe the right thing, like I said, is illegible, or somebody transcribes this, what is written wrongly, that's prescription error.
The effects of prescription error, can it be managed or reversed in patients if the patient is not dead?
Yeah, it can be. It can be managed. That's if the patient is not dead, like you said. It can be managed. For somebody who has penicillin reaction and is giving something that has to do with penicillin, the best thing is to stop giving the penicillin and offer another option. Somebody has gastrointestinal bleeding due to prolonged use of NSAIDs. That's the non-steroidal anti-inflammatory drug. Like I already said earlier, somebody who has ulcer and now is experiencing gastrointestinal bleeding. The first thing is to stop it. Now to give the right drug, to mitigate that already. So, yes, it's gradually on continuous education. In every field, there should be continuous education. Science is not static. The medical world is not static. So, per day, per year, per week,
minimize.
To fight this, yes. Then, evidence-based guidance. Okay, this has happened before. A lot of potential errors. Oh, this could happen when you are prescribing this. Is there any other thing to mitigate this? All of those aspects are how to prevent medication error. Then immediate action. So if there's prescription error, what's the first thing, to do? Report. Like I said, report. There is an internal reporting, in the hospital, they report the right patient information, the details of the error, what happened, and what circumstances led to that error, happening, and what's the action that they will take, They know what to do, and has there been any harm caused to the patient? They notify relevant authorities. The pharmacovigilance center, like I said earlier, it's a center under the National Agency for Food and Drug Administration and Control, NAFDAC. So they report the drug reaction or any adverse event, and everything is monitored, and also that's.
All right. Your call to action now, pharmacognosis, Awosola Fadolapo.
My basic advice would be that the prescription system should be encouraged at every point, every level of care in the country, and proper reporting, okay, should be done, and everything should be checked. It should be on the checklist at every point in time. I know the physician care to patients is actually what, but there are so many factors that we can put to play to ensure that the life and safety of Nigerians is top notch. So that would be my advice, and the patient also should also understand why, what, when am I using my medication, so it can help fight, these errors, and everybody can live better. So that's it.
All right, patient information, basic knowledge about every medication you have been issued or administered, proper caution on the part of healthcare practitioners is also key. Pharmacognosis, Oyindamola, Awosola Fadolapo, thank you so much for your time and expertise on prescription errors.
Thank you so much for having me.
All right.
I'm glad you had me here. And we hope that a lot of all our government and even private facilities would encourage electronic health record and telemedicine platform so as to put an end to this and make good use of it. Thank you.
All right, you are most welcome. That was pharmacognosis, Oyindamola Awosola Fadolapo, on prescription errors and the way to go. She has just encouraged the use of telemedicine and electronic prescription. Sound Health continues with trending health report from around the world. Please stay tuned. All right, the program has been Sound Health on Lagos Television, and we have been discussing prescription errors, how we can minimize this occurrence in our health facilities. Pharmacognosis Awosola Fadolapo has encouraged or recommended the use of telemedicine as well as electronic prescription at all health facilities. We hope this advice would be used. Well, this is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.